In this video, I'm going to talk about why we're so good at treating digestive problems. Hi, my name's Katherine Maslen. I'm a naturopath nutritionist and the founding director here at Brisbane Natural Health. And in this video, I want to talk to you guys about how we actually look at addressing gut problems and treating your gut, because it is the most common thing that people are presenting with. And no matter what condition that people have, usually there is a concurrent digestive problem going on as well. So naturopathically, our guts are the center of everything. A naturopathic term is that all disease begins in the gut, okay? So no matter what condition you have going on, it all starts here. And research is certainly backing that up. We now know that dysbiosis or bacterial imbalances in the gut can cause a wide range of health problems, everything from autoimmune disease to allergies to depression. Our gut microbiome, or the blend of bacteria in here, are really, really important for health. So your digestive system is quite complex. You've got, starting from your mouth to the stomach to the small intestine, large intestine, there's a lot that actually needs to go on in order for digestion to work properly. So there's a few things that go wrong with digestion. The first thing is that we can have deficiencies in acid and enzymes. So what happens then is we eat food, it sits in our stomach, it ferments, and then it gets into the lower intestine, and that fermentation causes bloating and wind and pain and problems. The other thing that can happen is the stress that we're undergoing will actually affect the function of the digestive system. So when you're stressed, the little pumps that produce acid will literally stop producing acid. So what that means then is, again, you have this maldigestion, you're bloated and you're not feeling great. The other thing that can happen is we can develop food intolerances. So we eat foods that used to be okay, and they actually cause a bit of an immune reaction in the gut, which then causes inflammation and bloating and pain, and again, we're feeling blah, okay? Another thing that's going on with the digestion, we mentioned that microbiome. So you have 2 to 3 kilos of bacteria in your gut and fungal organisms, etc. And this microbiome is essential for health, but also digestion. So what can happen is, as we take too many antibiotics, or we drink alcohol, or have too many refined carbohydrates, or not enough fiber is a really big one, is that your microbiome isn't as healthy anymore. And then what happens is we start getting these knock-on digestive problems. So what we experience in our practice is it's not normally one thing. When people come in, it's not normally only stomach acid or only dysbiosis or only pancreatic enzyme insufficiency. Normally it's a lovely combination of these, and it's because the digestive system's interacting with one another. And often one thing can lead to another. You have low stomach acid, then all of a sudden you don't have the acid to control the bacteria, and you have more of a bacterial overgrowth issue. So these are the type of things that we're thinking about when people are coming to see us. So the first step for anyone that's having a chronic digestive problem when they come and have their assessment is we talk about if we need to actually do what's called a comprehensive stool analysis. So this is where we get you to poo into a little tray, send it off to America, and when we get those results back, it will actually tell us what your bacterial levels and fungal levels are doing. It'll tell us if there's any parasites. It'll tell us if you're inflamed. It will tell us how you're digesting your food. It will tell us how your immune system is reacting to food in the environment. And this is really, really important information, because it means we can actually take this test, match it with your symptoms and how you're feeling, and develop a really concise treatment plan. So once we have all that information, we actually will treat it using herbal medicine primarily. So herbal medicine for digestive complaints, it works brilliantly. And I do really feel sorry for doctors sometimes, because if someone comes in and they're bloated or they're uncomfortable, unless they have a severe disease of the digestive system, there really isn't a lot your GP can do for you. But if you have bloating and digestive insufficiency, there's a number of different herbs that work really, really effectively to increase your own stomach acid, support your enzymes, reduce bloating, calm down the gut, and they work brilliantly. So what we'll do is come in with those to calm the symptoms, and then we'll actually use things to modify the bacteria and grow your good probiotic bacteria back, and also help, relieve constipation or diarrhea or whatever else is going on in the body. So when we're looking at a digestive problem, we're looking, okay, what's going on in the gut and what are the knock-on effects from that? How is that affecting your immune system? How is that affecting your stress? And how are those things affecting the gut indirectly? So we're always looking as naturopaths at what are the underlying causes of issues, but also how are things connected in the body, and what do you actually need to do to treat them? So that's a bit of an overview of the process that we go through when looking at your digestive health. If it's something that you want to look into more, please do make an appointment. The number is 07 336 70337. So any of our naturopaths are experts at digestive health, absolute specialists. So do give us a call and book an appointment and start feeling better right away.